Every organ in the body but the brain has a workaround. A failing heart can be bypassed, repaired, or replaced entirely. A damaged kidney has dialysis. A diseased liver can be transplanted. Surgeons can reconstruct a face, regrow skin, and reattach a severed hand. The brain doesn't work that way. You get one. There's no bypass, no dialysis equivalent, and no transplant list. When something goes wrong inside it, the options are limited in ways that don't apply anywhere else in medicine. Dr. Jubal, MedSchoolInsiders.com. Today, we're breaking down 10 neurology subspecialties, what each one involves, and where it can take your career. Vascular neurology is stroke medicine, and in the US, someone has a stroke every 40 seconds. Vascular neurologists manage acute stroke in the hours when treatment matters most, coordinate care in dedicated stroke units, and oversee long-term prevention for patients at high risk of a second event. Two interventions have transformed the field: intravenous TPA, a clot-dissolving drug, and mechanical thrombectomy, a catheter-based procedure for removing clots. Vascular neurologists work closely with interventional teams on both. The fellowship is 1 year and ACGME accredited. Epilepsy affects roughly 3 million adults in the US. For most, medication controls it well enough. For about a third, it doesn't. That refractory population is where epilepsy fellows spend most of their training. The work involves prolonged EEG monitoring, identifying seizure foci, and evaluating whether a patient is a surgical candidate. When surgery is on the table, epileptologists work alongside neurosurgeons to map the brain before any resection happens. The fellowship is 1 year and ACGME accredited. Movement disorder specialists focus on conditions that disrupt the brain's ability to control voluntary and involuntary movement. Parkinson's disease is the most common, but the field also covers essential tremor, Huntington's disease, dystonia, and several rarer conditions. The treatment landscape has shifted significantly. Deep brain stimulation is now a standard option for well-selected Parkinson's patients, and these specialized neurologists are the ones who identify candidates, program devices, and manage patients long-term. New disease-modifying therapies are also in late-stage trials, making this one of the more active research areas in neurology. Fellowship is typically 1 year, but it's not ACGME accredited at this time. Neurocritical care is the ICU side of neurology. Neurocritical care physicians manage the sickest neurological patients around the clock. This includes patients with massive strokes, subarachnoid hemorrhage, status epilepticus, severe traumatic brain injury, and spinal cord injuries. The specialty sits at the intersection of neurology and critical care medicine, and fellows develop a skill set that spans both. Continuous EEG monitoring, intracranial pressure management, and rapid decision-making under pressure are all part of the job. It's one of the higher acuity paths in neurology, and demand for trained neurointensivists has grown steadily as dedicated neuro-ICUs expand at major centers. The fellowship is 1 year and ACGME accredited. Child neurology is different from every other entry on this list. It's not a fellowship you pursue after neurology residency. It's a separate 5-year residency you apply to directly from medical school, combining pediatrics and neurology training into a single program. Child neurologists manage epilepsy, cerebral palsy, muscular dystrophy, neurodevelopmental disorders, including autism spectrum disorder, and pediatric stroke, among others. The conditions, the pharmacology, and the way you communicate with patients and families all require a different foundation than adult neurology provides. Further subspecialization is possible through fellowship, including pediatric epilepsy and pediatric neuromuscular disease. Check out our deep dive video, So You Want to Be a Child Neurologist, link in the description. Neuro-oncologists manage primary and metastatic brain tumors, working at the intersection of neurology and oncology. While surgical neuro-oncologists operate, neuro-oncologists handle everything surrounding that surgery, from chemotherapy to immunotherapy to radiation coordination to the long-term neurological complications of treatment itself. Glioblastoma, the most lethal primary brain tumor in adults, has a median survival of approximately 15 months despite the most aggressive treatment. Much of neuro-oncology involves managing a disease that currently can't be cured, which demands both clinical precision and a particular kind of emotional endurance. The fellowship runs for 1 to 3 years and is accredited by the UCNS rather than by the ACGME. Neuromuscular medicine covers diseases of the peripheral nerves, neuromuscular junction, and muscles. ALS, muscular dystrophy, myasthenia gravis, Guillain-Barré syndrome, and peripheral neuropathies all fall within this specialty. The diagnostic work is technically demanding. Neuromuscular physicians interpret electromyography and nerve conduction studies, procedures that require both technical skill and careful pattern recognition to localize disease and guide treatment. For conditions like ALS, where there is no cure, the role shifts toward preserving function and quality of life for as long as possible. The fellowship is 1 year and ACGME accredited. Not sure if neurology is the right fit? Take the free doctor career quiz at specialtyquiz.com. It matches you to specialties based on your personality, interests, and career priorities in just a few minutes. Behavioral neurology focuses on how brain disease affects cognition, personality, memory, and behavior. Alzheimer's disease and other dementias are the core of the field, but it also covers traumatic brain injury, frontotemporal dementia, and conditions like Huntington's disease that blur the line between neurology and psychiatry. As the US population ages, the demand for behavioral neurologists is outpacing the specialty's ability to produce them. The work is less procedural than most of neurology and more reliant on careful history taking, neuropsychological testing, and longitudinal relationships with patients and families. The fellowship is 1 year and ACGME accredited. If you're eyeing any of these specialties, there's one thing most premeds don't realize. Preparing to apply to residency starts the moment you decide you want to become a doctor. The relationships you build, the research you start early, how you optimize your time, the medical school you get into. These are the details that keep your doors open no matter which specialty you end up chasing. Getting those moves right early on is hard to do on your own. I've made plenty of mistakes myself, and I want to help you avoid them. That's what our school community is for. You get direct access to me and our team of insiders in small group sessions, doctors who've served on admissions committees and can help you make the right calls now so future you can compete for any specialty on this list. Link in the description. Migraines affect roughly 12% of the US population, making it one of the most common neurological conditions in the world and one of the most undertreated. Headache medicine specialists treat the full spectrum of primary headache disorders, from migraines and cluster headaches to medication overuse headaches. Treatment combines preventive therapies, acute medications, and procedures like nerve blocks and Botox injections. The field has seen significant therapeutic advances in the last decade with the development of CGRP-targeted treatments. The fellowship is 1 year and ACGME accredited. Clinical neurophysiology is the subspecialty behind the machines, from EEG for seizure monitoring to electromyography and nerve conduction studies for neuromuscular diagnosis to intraoperative neuromonitoring during spine and brain surgery. These are the tools that make much of the rest of neurology possible, and clinical neurophysiologists are the ones who perform and interpret them. It's a less visible role than most on this list, but epileptologists, neuromuscular physicians, and neurosurgeons all depend on it. Without clinical neurophysiologists, many of the procedures and diagnoses covered earlier in this video wouldn't be possible. The fellowship is 1 year and ACGME accredited. If neurology caught your attention, the next step is making sure the day-to-day reality actually matches what you're looking for. Our So You Want to Be a Neurologist episode covers the full training path, what life in the specialty looks like, and gives an honest breakdown of the pros and cons. Watch it right up here, and join the school community to take advantage of our live physician Q&A sessions.